Hi folks, thank you for watching this video. Please subscribe my channel for more videos. Pregnant females wonder, how could smoking hurt the baby child? People that smoke decide every day to gradually destroy themselves. It truly is a choice they make. Thought they get an option to hurt their new offspring. I shout there should be a regulation against smoking and drugs when pregnant, since it is confirmed these things do permanent damage to your offspring. It is abnormal why smokers want to declare it is okay to smoke when mothers and they shout it does not damage their infant and they wish people trust them. If we damage another person we go to prison. On the contrary, when we destroy our own baby through inserting toxins nobody says one thing. How sad this is. Subsequently, perhaps by putting several facts now for everyone to study, more public will get energetic to stop this terrible thing. Please read this because it is urgent. You control your desires so you can discover remedies to quit smoking naturally. How does smoking hurt kids? Below is a medical record. I am going to clarify this plainly because it is evident that every person understands it. Here is the inventory of known harmful damage to the infant a woman is carrying. Unintentional unexplained abortions. In other words, the demise of babies for no identified good cause. Ectopic pregnancies, which is a fertilized egg that has rooted out of the uterus. The mother's egg is rooted in the ovary, fallopian tubes, cervix, or the abdomen. As the fetus develops, it sooner or later will trigger the organ to explode. This brings about relentless blood loss and endangers the mother's life. In the average ectopic pregnancy the child dies and sometimes so does the mother. Fetal brain damage, brain injury prompted by malformation such as vascular, numerous scary consequences ranging from cerebral palsy, damaged human brain and nerve tissues, reduced motor functions to reduced development. Nobody wishes their baby to be born with these problems. Now you understand why I believe smoking during being pregnant is a crime. Growth retardation / minimal birth weight. Health risks consist of illness throughout the first days of life. Some illnesses can produce fatality, infections, and long-term effects including impaired growth, delayed motor skills, delayed social development, and education disabilities. Lower or higher than regular infant blood pressure. Children with blood pressure problems are at much higher risk of a major heart attack in their 20s. Children with higher blood pressure might have more problems with weight or kidney breakdown and more. Trouble requiring neonatal intensive care. This is extraordinary treatment services for infants with the most demanding medical problems, especially those that require surgical procedures within days or weeks of birth. Child fatality from perinatal problems. Brain lesions that take place during a window of time involving a few days prior to birth and couple of days following. Sudden infant death syndrome. This is the death of the infant for no certain reason between delivery and 1 year of age. Your infant is at a much higher danger for SIDS. Psychological retardation. Consists of below average brain power, and a lack of the proficiency required for regular daily life. Babies with terrible mental retardation conduct themselves similar to children all their lives. Respiratory problems during childhood, including colds, flu, runny noses, sore throats, and coughs. The number of kids might in addition have chronic illnesses that distress the breathing organism, like asthma and cystic fibrosis cf. Your child could also be in danger the remaining of his or her existence for pneumonia, tuberculosis, sleep disorders, tonsillitis, and even lung cancer. Attention deficit disorder, making it tricky if not unattainable to concentrate and be taught. This will certainly affect the ability to pass any lessons at school and cause troublesome conduct. Behavioral trouble, violence, and criminality. Your newborn will end up in prison on account of emotional problems brought on by your smoking. Cancer-causing agents in infants' blood, possibly carcinogenic mutations, and childhood leukemia while you are trying to quit while being inquired is MRD okay? The plain answer is that party can be more harmful to the infant than cigarettes. The dilemma is not just smoked nicotine. On January 8, 2006, Professor Theodore Slotkin, a leading nicotine research toxicologist at Duke University Medical Center, stated, "There is abundant data that the chief difficulty for fetal progress is subjection to nicotine rather of other components of harmful cigarettes. Do your own studies, but this is what I have found. Smoking and secondhand smoke among baby women is a major cause of spontaneous abortions, stillbirths, and sudden infant death syndrome (SIDS). According to a meta-analysis of published studies, tobacco use is responsible each year for 19,000 to 141,000 spontaneous abortions, 1,900 to 4,800 infant deaths caused by perinatal or pre-birth disorders, and 1,200 to 2,200 deaths from SIDS. The more recent comprehensive study found that parental smoking causes 2,800 deaths at birth and 2,000 deaths from SIDS. According to a 1997 study, kids' exposure to secondhand smoke leads to over 500,000 physician visits for asthma and 1.3 million visits for coughs, and to more than 115,000 episodes of pneumonia, 14,000 tonsillectomies or adenoidectomies, 260,000 episodes of bronchitis, 2 million cases of obus media among children and acute or chronic inflammation or the middle ear, and 5,200 tympanostomies, middle ear operations. Hi folks, thank you for watching this video. Please subscribe my channel for more videos. Pregnant females wonder, how could smoking hurt the baby child? People that smoke decide every day to gradually destroy themselves. It truly is a choice they make. Thought they get an option to hurt their new offspring. I shout there should be a regulation against smoking and drugs when pregnant, since it is confirmed these things